I want to talk initially about what the difference is between Alzheimer's and dementia. Dementia is actually not a disease, although we use that word as a disease. Dementia is a bunch of symptoms that are actually present in over 70 diseases. The symptoms are things like memory loss, the things you see, confusion, changes of personality, things like that. They are lumped in what is called dementia, although even doctors are guilty of this, saying you have dementia instead of attempting to define what kind of dementia there are. There are what I'm going to call the big four diseases in dementia. The rest are very small and obscure. By far, the biggest disease is Alzheimer's. It says up there 65% they think of all people with dementias have Alzheimer's. Just because you have Alzheimer's does not mean that you can't have another disease, another dementia disease on top of it, which makes it very, very difficult for the family and caregivers to cope. The next biggest disease is vascular disease, and it's not unusual for people to have both Alzheimer's and vascular. Vascular disease is essentially strokes. Mini strokes, little TIAs, or big strokes. But that essentially damages the arteries. It actually knocks out the arteries in the brain. So depending on where the arteries are that knocked out, then that's where you get certain characteristics of deficit in the brain. Lewy body disease is the third largest, and Lewy body disease is not well known, but it should be. If you think of the dementias as a continuum with Alzheimer's on this end and Parkinson's on this end, you put Lewy body right in the middle. It has both sort of symptoms. Lewy body is inside a cell, and it looks like a raisin, but it's a very toxic raisin that will kill the cell, the nerve cell. 60% of Parkinson's people will eventually end up with a dementia. In Parkinson's, usually, almost always, the physical problems start first. It's later on in the disease that the dementia develops, the motor skills in Parkinson's. But nevertheless, you're still faced with somebody who has a dementia on top of the fact that their body is not functioning the way it's supposed to. Frontal temporal dementia is probably one of the most devious dementias there is, especially for caregivers to try and take care of and for and with. It is a dementia that does not always show memory loss. So you may have a person who has what's called executive functions up in the front of the brain that are just deficient as all get out, but their memory's intact. So you can't use any of the tricks that you use for memory loss people. It's a real, real, real problem for families and for caregivers. There are some dementias that are treatable. And the reason I bring this up is because most of your clients, I'm going to guess, have never had an actual diagnosis. What they've had is a 15-minute test by their doctor, by their general practitioner, and then he throws some Aricept or Namenda or something like that, one of the drugs, at the family. That is not a full-baked, what I call, diagnosis. So what I'm telling you is most of your families don't know what they have. You may want to consider asking them to get a diagnosis, a fully baked diagnosis. And a fully baked diagnosis essentially consists of three parts. Yes, there's testing. You remember the day, the week, so on and so forth. But that testing is about a minimum of 1 hour and a maximum of 4 hours. I'm talking about lots of different tests to tell people what portions of the brain are hurt. Excuse me for a minute. Okay. Then people, the second part of that is people need to get an MRI or a PET scan or something like that to show them if, in fact, they've had a stroke or a mini stroke. Many people, especially the mini strokes, just don't know. Finally, there are specific blood tests that are given to look for specific deficiencies that are treatable, that mimic what a dementia is, and so B12 deficiency is one of the big ones. There are, thyroid imbalance is a huge thing. It can present as dementia. So you may actually have clients that are not demented. All they need to do is go to the doctor and ask for these things. Like I said, the half-baked diagnosis is 15 minutes and then throw some medicine at them. My question to you and your families is, what if you had somebody in the household who had a dementia and it was treatable? How bad would the family feel if they didn't pursue that? Not everybody will go the full baked diagnosis. Neurologists will, geriatric psychiatrists will, and the occasional family doctor will do it too, but they just need to be asked.